Healthcare has been a hot topic in the United States recently. Specifically, whether or not the government should sponsor healthcare for all Americans, which is a public healthcare system, or whether people should be responsible for buying their own insurance, which is a private healthcare system. But before we get into which is better, let's go over the basic arguments for both sides. The public healthcare debate centers around those who cannot afford insurance. It frames healthcare as a right rather than a commodity, and as such, everyone is entitled to it, especially those who cannot afford the insurance or those who have pre-existing conditions that prevent them from obtaining the insurance that's available to most. It would be negligent, in their view, to deny healthcare to someone just because they are poor or already sick. Insurance companies are seen as greedy and therefore cannot be trusted to provide quality insurance to everyone. Instead, the government is seen as the necessary provider who will ensure equitable health care. The care would be covered by taxpayer dollars and would regard doctors as government employees. Private healthcare, on the other hand, does not see healthcare as a right. It sees it as a commodity, and thus, it should be a marketable good. Private healthcare advocates say that marketing healthcare as a commodity reduces the price for quality care, and they state that healthcare is not supposed to be there to cover walk-in clinic visits, but is actually more for catastrophic insurance. This is when someone has a major surgery or needs help paying for chemotherapy. Furthermore, they acknowledge that not everyone will have healthcare, but charity, either through free treatment or people donating to pay for the procedure, can cover the cost. They claim it is unfair and immoral to demand a doctor cares for any given patient, and to assume that other taxpayers will cover the cumulative millions that public health insurance costs. So now we have a basic outline of both systems, and it's time to discuss which is better for the American people. Public healthcare offers valid critiques to the healthcare system, but sacrifices quality for equity. To further explain this, there are three possible elements that can make up healthcare: affordability, quality, and universality. Only two of these can make up any given healthcare system at one time. Private healthcare has quality and affordability, while public healthcare has universality and affordability. Private healthcare sacrifices universality because proponents do not believe it's necessary for most medical procedures anyways, and public healthcare sacrifices quality because it cannot afford to provide cheap care for everyone that is great quality. Private healthcare centers on different insurance companies competing for customers, which lowers prices while maintaining quality. Competition for goods has lowered prices for procedures like LASIK eye surgery, which is not covered by health insurance and is the most unregulated medical procedure out there. It used to cost $20,000 per eye, but now it costs $1,000 to $4,000 per eye because of extreme competition in the market. It also incentivizes doctors to enter that field because it is a cash business and there are few government hoops to jump through. In the end, LASIK eye surgery is a great example of what the market can do for healthcare. Ultimately, there are people who will not have health insurance under a private healthcare system, but costs will be lower and it will be more affordable for those who need it. Not every person wants health insurance, like those who just exit college and do not have a need for catastrophic insurance at the moment. For those who do not buy it because they don't have the money, private charity is available to them. Public healthcare mandates that everyone pays for healthcare through taxes, and leaves the freedom of Americans to spend money the way they see fit by the wayside. Private healthcare offers quality, affordability, and freedom to choose how you want to spend your money, all of which fits fairly perfectly into American life and values. For these reasons, private healthcare is a superior system.